Welcome to Spotlight. A commitment from government to improving care and support for people with chronic fatigue syndrome. It comes after today's inquest into the death of Maeve Boothby O'Neill, who died at home after 3 admissions to hospital caused by malnutrition from ME. A coroner has concluded a young woman from Devon died from natural causes because of severe ME. Maeve Boothby O'Neill had been suffering from fatigue since she was 13. By the time she died, aged 27, she was unable to chew food or sit up. Today, the coroner said it is not possible to say if any treatment could have halted her decline, but she hoped lessons will be learned in the hope future deaths can be prevented. A health minister says the government will publish a plan in the winter that will focus on improving the lives of people with this condition. Here's our health correspondent, Jen Smith.
This is just some of the paperwork Sarah has had to get to grips with during the inquest into her daughter's death. It's been a complicated hearing that's taken 3 years to get to this point.
All I wanted was for it to be public so that people could know that death was a real possibility and not about, it's not a mental health condition. This is a really serious illness that is going to kill someone if you don't understand what you're looking at. It's very hard to give evidence now, nearly 3 years later, without having had a lot of time to think about it, because we have all had a lot of time to think about it. What went wrong? This wasn't supposed to happen. And I genuinely believe that they did not believe that she was going to die.
Sarah, along with Maeve's dad, her former husband, Sean O'Neill, have been tenacious in their efforts to raise awareness about Maeve's case. Thanks to them, the inquest has been widely reported, as headlines around a lack of understanding and treatment of ME have made national news. So will this be the catalyst for change that many are hoping for?
They now understand what they should have done and that they've written a plan for what they should have done. They've got standard operating procedures for what should be done. What I'm less hopeful about is that that will become widely known.
For a young woman from a loving family in Devon to die of dehydration and malnutrition in this day and age is difficult to comprehend. Put simply, the inquest heard no one knew how best to treat Maeve. And there are other families in Devon, like Maeve's, terrified of what might happen to their loved one with severe ME.
When we spoke to her last year, Alice was at the point of dying from malnutrition. Since being at home, she has stabilised, because in hospital she deteriorated very rapidly and her nutritional intake has increased, and a few other small improvements have happened. Unfortunately, recovery for ME is very slow and long.
Rosie's sister Alice has been living with ME for nearly 4 years. Last year, the Royal Devon and Exeter Hospital changed its care plan for Alice after her family campaigned for her to be fed lying down, a deviation from the hospital's usual policy. It was the same hospital that treated Maeve 2 years before.
Because there is no known treatment for ME, the unknown of how long she'll be this ill or whether she'll make a recovery is hard.
Do you think that this inquest will be a catalyst for change?
I think Maeve's case has obviously increased awareness within the public. I think, and also Royal Devon University Hospital has created some new standard operating procedures. However, there's still a very long way to go.
The inquest heard from medical experts who said there's no specialist unit for ME patients anywhere in the country. It highlighted the need for properly funded research and better understanding around the condition. It also noted some doctors expressed doubt that ME has a biological basis, a stigma that some groups are campaigning to change.
What we need to see is clear, tangible pathways of care for people with ME, and also where there are people with very severe ME having direct access to experts. And we also need to see education and an acceleration of research, because one day there will be treatments and that needs to happen sooner rather than later.
We asked the Royal Devon and Exeter Hospital for an interview with Dr. David Strain. It's leading ME consultant who gave evidence to the inquest, but was told it wasn't possible at this point. Sarah's worry is that the ME treatment devised by the hospital won't be rolled out nationally. She says Maeve deserves a fitting legacy.
Well, there are other people who've died from ME who made a difference to us. So I know she's made a difference to the people with ME because they tell me. I've had lots of people telling me how thankful they are, but that's not enough. Yet another death isn't enough. It's the institutional change that we need.
Maeve died after refusing to go into hospital for a fourth time, believing nothing would be done for her. She was 27 years old.
Our reporter John Ayres was at the inquest today. John, what more did the coroner say?
Well, the thing about ME, or chronic fatigue syndrome as it's sometimes known, is the problem is there's lots that isn't known about it. And there's this historic debate about whether it's a physical disease or a psychological disease. And there's been lots of questions in this inquest trying to work out whether any of this got in the way of Maeve's care. Well, the assistant coroner for Devon, Deborah Archer, said that the reality of this case is it's not possible to say if any treatment could have halted her decline. She hopes lessons will be learnt in the future to prevent further deaths and said she died of natural causes. She also declined Maeve's parents' request to attach a neglect rider to her findings.
And what's been the response to today's conclusion?
Well, the Minister for Public Health, Andrew Glynn, has pledged to improve the care and support for those affected, and they're publishing a plan on that this winter. Now, Maeve's mother, Sarah, has texted me in response to the Minister's statement to say that long COVID is ME in 50% of cases, and the numbers are so great and growing that the NHS must change tack throughout the UK. The Royal Devon University Healthcare Trust say they offer their deepest sympathy to Maeve's family. Everyone involved in her care were profoundly impacted. They've learnt from the case and they will take time to consider the coroner's findings and will take forward any findings identified. And there's still a prevention of future deaths hearing due to take place next month.
John Ayres, thank you very much.